NBC News medical contributor Dr. Kavita Patel with more on all this. So, Dr. Patel, staying with COVID, what do you make of the apparent difference here we're seeing in the guidance between the CDC and the Trump administration? How should parents interpret all this?
Yeah, I think it leaves parents and honestly, Joe, clinicians confused because there's contradicting guidance, as Liz mentioned in her piece. I do think that the bottom line is that you need to have a conversation with a health professional if you are a healthy pregnant woman. And I would highly encourage the American College of Obstetricians and Gynecologists has already put out a statement that they recommend all pregnant women get the COVID vaccine. There actually have been trials done that included pregnant women and there were no adverse events and it showed a large benefit. And then if you're a parent with a healthy child under the age of 18, you're also going to need to have a conversation. But again, the American Academy of Pediatrics also recommended that children, healthy children, including young ones, especially who are at risk of hospitalizations and death, that they also get the COVID shots. But it's going to get, unfortunately, tricky as we're waiting for more detailed guidance in writing. So far, it's been videos, social media, and a CDC website that indicates it should be done with a conversation with your doctor.
Yeah, and this comes as the World Health Organization monitors a new COVID variant that's now been reported here in the U.S. What should we know about this?
Right. So this is not surprising that we're seeing new variants. And so this is NB181. It's on the heels of what's already the dominant variant across the world called LP81. All those numbers and letters mean is that we're seeing genetic differences that are different from the previous strains. There are no signs right now today, Joe, that in the United States or even globally that one is causing more of a potential problem in terms of disease or hospitalizations. So this is something that we're going to closely monitor. And especially as we enter into what we expect will be a busy winter season with lots of viruses, including COVID, it's just another reminder that you need to kind of take precaution. Nobody wants to miss work or school because they're sick. And these are one of the many reasons that people could do that. Vaccines can help, but if you get symptoms, see a doctor.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.